So, for those who might have just joined us, my name is Dr. Chris Dickie. I'm the President of General Practice Registrars Australia, and I'm just going to walk through the changes to the NTCER that have came in this year. So, first of all, we were advised by members and stakeholders that there's too many words in the NTCR in some places. So, we removed a lot of the preamble that was things like the history of the NTCR that doesn't need to live in that document. On remuneration, the base rate is being adjusted with the MBS indexation each year. So it was 2.6% this year, and that will apply across all levels of training each year. Members often tell us their payslips can be confusing, and there may not be information, particularly around things like their leave entitlements on their payslips. So that's now been inserted as best practice in keeping with the Fair Work Act and highlights the legal requirements that payslips need to have. Registrars also tell us that they may not always be able to see their own billings, so we've strengthened that. So where practice management software allows registrars to access their own data only and not be able to see any others, because annoyingly some systems only work on a tick box basis, you should be able to see your billings at all times. If you're not able to just tick that box to say only you can see your billings, then you should be provided at least weekly and no less read often than anyone else at practice. For the purposes of any top-up type payments, so that could be things related to billings, to PIPs, to anything else that kind of tops up. These all need to be provided to yourself to understand how the calculations have been done, and that's agreed in your employment contract how often that'll be done. Things like PIPs and SIPs, the payment of incentives, after you finish employment, need to still be paid to you. However, it is your responsibility to make sure that the practice has up-to-date payment details, which is quite reasonable. We inserted around public holidays that substitution of public holidays is already provided on under the national employment standards, but many people weren't aware of that. So that means if the practice is open on a public holiday, you can discuss with your practice around if you want to work on that day, how you're going to substitute that out based on those guidelines. This is one I was most excited about, so the introduction of ceremonial and cultural leave, which is new in the NTCER. So you're able to take ceremonial or culture leave in negotiation with your practice as leave without pay. The important thing anytime you're taking a leave is to make sure you understand the impact on your training time, so with the training colleges, and that's the next bit of advocacy for us, perhaps, where we make sure that that doesn't impact on your training time. Administration time, we were told, can sometimes be quite restrictive, particularly as you're coming towards the end of your training. You may not want as much administration time. So now you have the ability, completely up to yourself, to reduce that in GPT-3 to 15 minutes per half day, or in GPT-4 to completely remove it. But it's completely at your discretion and can be reintroduced as necessary. Confusion often happens if people change their employment during a training contract, particularly things like moving from full-time to part-time status. So we've included a statement that changes to the employment status or fraction or by mutual agreement. So both you and your employer, the practice, need to agree on that and require an amendment to the actual employment contract because that's the thing that's important and underpins everything. And orientation, we've tidied up a bit to make sure that it should be part of your ordinary rostered hours during the training term, except in any extraordinary circumstances. If it does occur outside of those hours, uh, the extra hours are additional extra hours. And if it's outside of that again, then it may be considered overtime. So there's detail through in the NTCR on that. And I think the final one here was around the bulk billing PIP split. So the government's incentive for us to be bulk billing. We're continuing to support the government's intent that a 50-50 split should happen between practitioners and practices, and that's our advocacy position. And again, that's something that should be clarified in your employment contract. So a few tips to run through. As an AGPT registrar, your employees, you're not a contractor, and there's a number of things that are important related to that status, that being an employee is different to being independent contractor. Things like supervisor fees or payroll tax should never be deducted from your earnings. I know that sounds like it should just always happen, but we come across difficult cases sometimes. Education release is part of your normal contracted hours. It's not an allowance on top of anything. It's going to a mandated education workshop is the same as going to work effectively. And earnings are always plus super. So anything that you earn, you'll be getting super paid on top of those earnings. Payslip should be issued within 1 day of when you get paid. I need to include information around things like the accrued leave balances for the registrar, along with the payments that are being made to you. I'd recommend that you have a little look around fatigue management in the NTCR, particularly for anyone that works across both general practice and hospital type settings as a rural generalist, because there's some really important things there around making sure we keep you safe and ultimately keeping your patients safe as well. We also talk in NTCR around the types of leave available, including annual leave, personal leave, but also excitingly this new cultural and ceremonial leave. How important it is that you have an employment contract that's up to date and you understand what it's saying. And if you ever have questions around that, reaching out to us to ask. And around any incentives. So the PIPs, the SIPs, the federal government new incentives need to be paid through to you, even if you've moved into another practice. And again, information on our website, but happy to take any questions. So things that GPRA can help with. We have the NTCRs there on our website available to everyone to look at freely. I appreciate that sometimes it can be a bit confusing, so we have a set of FAQs that members can access, and the new updates are coming very soon. And then we also have, of course, our registrar advisors, as I mentioned, that you can ask any questions to. Contacting us, we have a phone number that's picked up during office hours that you're more than welcome to contact. You can email through to us. We're physically there in the centre of Melbourne and open Monday to Friday. And if people ever want to reach out to me directly, I'm also happy. So that's president@gpra.org.au.